Hi everyone, I'm Karin Allenspach. I'm a co-founder and current Chief Medical Officer of 3D Health Solutions here in Ames. And we're really all about organoids or three-dimensional intestinal epithelial cultures from dogs and how to use them to improve all sorts of problems that we encounter in medicine. One specific one that we've been focusing on over the last maybe 1.5 years is bladder cancer. And interestingly, actually, bladder cancer is something that happens fairly commonly here in the Midwest. No one knows why exactly. Maybe it has to do with pesticides or something else that's going on here. But what's also interesting from a veterinary perspective, since we're vets, is actually that bladder cancer in dogs and in humans seems to be a very similar disease. So it's a very good kind of analogous model, if you want to find out what's happening on the human side and have a good animal model for it. So bladder cancer in humans is a relatively big problem. It's about the 9th most common cancer encountered. And the most common type is called urothelial carcinoma, or UC. And there's about 1/4 of people who get bladder cancer that get a very invasive, sort of bad, prognostically bad form of it, which is called muscle invasive bladder cancer. And you can see the picture there. You can see how it invades into the muscle layer of the bladder. And that's a very bad sign because that also means that they metastasize very quickly. And it's a bad disease overall because you really die, unfortunately, pretty quickly of it. And there's not very many good treatment options out there to really do something about that. What people do these days is that they get chemotherapy. But the problem with the chemotherapy is that a lot of times it doesn't work. So about 50% of patients are treated with chemotherapy, but it doesn't actually work on them. So that's a problem because they're basically treated with chemo with a lot of side effects without having any benefits. And they also delay treatment that might save their life, like taking out the bladder if it needs to be coming to that. So what is the problem that we're trying to address here with this bladder cancer thing? So one of the things is that organoid technologies have been out there for a little while, and people have also been doing it on bladder cancer, but all of the techniques that are out there right now are based on invasive biopsy acquisition, which means you have to go to a referral center, you have to have a procedure performed where they biopsy the cancer, and then from there you can try and grow organoids or little three-dimensional tumors in a dish. The problem with that is that a lot of times when you take these biopsies, because you do it by laser, you take them out and they're actually very damaged, these cells. So they don't grow very often and they don't grow very well. So the technique has basically not taken off because it just doesn't work very well most of the time. So what we've been doing is a really kind of novel thing here because we've been able to grow bladder cancer three-dimensional little mini cancers from non-invasively obtained urine samples. So all you do is pee into a little glass basically, and we can then go ahead and grow up these little mini tumors. Now, why would we do that? We do that because that has actually been shown that you can use it to predict treatment. So you can basically take these little mini organs in the dish, treat them with chemotherapy and see if they respond. And that will then tell you whether the person that has the bladder cancer that it came from will actually respond to the chemotherapy as well. Well, that would be great because that basically tells you within about 2 to 3 weeks after having the diagnosis whether you really need to go with that chemotherapy, and if so, which one has the best ability to actually work. So the other thing is that, as I just said, bladder cancer in dogs seems to be very similar, actually. Again, it's very frequently seen in the Midwest. It is clinically very similar to this muscle-invasive bladder cancer. And it metastasizes just like in humans, is associated with poor survival and no good treatment options. So it's really kind of a very similar clinical presentation and disease. So we've developed this for both human and canine bladder cancer, and we're able to grow these little mini tumors that you can see here. These are the organoids that you can see. When they're 2 days old, they're little spheroids, and then eventually they grow up into sort of little larger blobs of cells. And they, can basically be used for testing the chemotherapy on. What we've been doing so far as well is with a collaboration with the Mayo Clinic at Rochester in Minnesota, but also with an internal grant that we got from the VPR office, as well as from the Berry Cancer Foundation. And what they've been helping us with is basically establish whether what we have in the dish is really also what we see in the patient. Because of course, if it's not the same, then it's not going to be useful. So we really needed to establish sort of baseline facts to show that we're really dealing with the same kind of cell types. And what I can show you here is basically this is one of the markers called keratin 7, which proves that this is really cancer from the bladder, and you can see it much less expressed in healthy bladder organoids as opposed to the ones that we got from bladder cancer. Similarly, with another marker that we've looked at, this is CD44, which is a stem cell marker, and this is another one that's very typically only seen in bladder cancer. As you can see here, everything in red. And then we've done that for bladder cancer organoids from humans as well. And this work really has been done at the Mayo Clinic. And what they've been able to show is, in addition to, yes, it's really cancer from the bladder, also that it's negative for PAX8. And that's important because that means that these cells are not coming from the kidney. Okay, so we're not confusing anything here. The cells that we're growing are really just from those bladder cancers, and that's an important thing so that you are actually looking at what you want to test. And we've done some testing as well in the laboratory so far to look at these three-dimensional organs and basically look at how they respond to treatment with chemotherapy. And what I can show you here is basically a dose-response curve. So what you can see is that from going from nothing, basically not giving any drug, to giving more and more drug, you can see that less and less cells survive. And that's basically what you want to see if the tumor responds. Okay, so this would be an example where you would predict that that tumor actually in the patient will respond to that chemotherapy. So in summary, our technology to grow bladder cancer organoids can actually do it non-invasively from the urine, from dogs and humans. We have established chemosensitivity testing in human and canine organoids. And this is something that can be scaled very quickly. There's already equipment out there that you can buy, for example, Celico cell counter equipment that is already doing this in other applications. So this is going to be a quick thing. It doesn't need a lot of R&D anymore. And in addition, we're now trying to develop co-culture methods to test immunotherapy, because immune checkpoint inhibitors are one of the novel treatment options that have come up, and that's also something that we want to be able to test in these organoids. What's the market size? So the global organoid market size is actually just come up. So this is sort of just about 2019 to 2020 about when the first market reports came out, and it's estimated at about 400 million in the US in 2019-20, but it has an expected growth rate of about 22.5% in the next 5 to 10 years. IP situation, again, we have a non-provisional US patent that has been filed in September 2020 with 3D Health Solutions, and we have an exclusive license to commercialize any assays with 3DHS until 2027. What are we looking for here? I think we're looking for investment with regards to performing a proof of concept study. What we need for that is to expand our patients or samples from patients to about 100 for muscle-invasive bladder cancer. And that can be done through Mayo and quickly because they have clinical trials going on. So we can then also scale it up fairly quickly. And that needs then to be correlated with what the response in vivo in the patient is, so that we can actually prove that what we're doing is actually predictive. And the other thing, or maybe going along with that, is to scale up these chemosensitivity tests, we will need investment into equipment, and that equipment is around 250K. And that's all I have to say about bladder cancer. Thank you so much.